Do you want to do an introduction?
And we are live. Yes, definitely. I'd love an introduction, Prof. Thank you so much for joining us and welcome to it, to another installment of our webinar series right here on Oram Pop. And we are live on all our streaming platforms. We are on a StreamYard as it gives us the, can I say basics, or rather the original platform where we are broadcasting from. Also on our YouTube channel, it is Oram Pop. On Facebook, it is at Oram Pop. On Twitter, it is at @n_health. My name is Vigan Kosi, and thank you so much for being with us today. We really apologize sincerely for starting way ahead of time. It has been scheduled for 1 o'clock because, but we had some difficult or rather technical difficulties behind the scenes to try to bring you this webinar. But without wasting any more time today, we are joined by Prof. Edward, who is going to take us through their slides as we look at mental health and mental health services. We'll be speaking to some of the services that are available when it comes to mental health for men who have sex with men and transgendered women, or key populations, as it were. And you are more than welcome to join in and jot down some of your questions that you have for us, and send them through on the comment section below. I apologize because I'm from courtesy of home, so you'll be hearing a lot
Thank
of
you.
cars in the background. But right about now, though, let's take it to Prof. Prof, take us away. Good afternoon.
Thank you so much. Thank you so much for inviting me. And I'd like to say how happy I am to work at the Orum's Popping Clinics. I've been a couple of times now to the Popping Clinic in Swane and to the Popping Clinic in Ikuhuleni. And I'm really proud and grateful that we are starting a pilot study. The pilot study has a difficult title, but it is called the Development and Evaluation of an Online Mental Health Coaching Intervention. Perhaps we can go to the next slide. Can you proceed the slides? Yeah, go to the next one. So mental health and key populations. We all know from our experience that key populations face many challenges, difficulties within families, sometimes school dropouts, employment challenges, there is abuse, there is community and religious marginalization, and sometimes sex work or other risk behaviors. And this is a picture of the rainbow, and I'm really proud that in South Africa there is a rainbow constitution recognizing all people's existence. Next slide. So when mental health and key population are put together, there is a challenge that this abuse and exclusion can lead to psychological trauma. And this trauma can manifest as depression, anxiety, self-harm, substance use, lack of self-esteem, and other risky situations. Next slide. So what to do about it? Where do we go? And we know there is a need for mental health well-being support, but there is very limited public health services for psychological trauma, depression, or even self-harm. And who here in the audience knows where to seek help in public health facilities? So we at the Popping Clinics have been thinking that we would like to train lay mental health coaches. Next slide. And we refer to this as a pilot mental health study. Researchers, they like to do studies and then publish reports, and through publications they are able to get more support to start a program. And our hypothesis is that we can improve mental health issues among MSM at Orum's Popping Clinics, and then we will also improve PrEP and ART adherence. Next slide. Think about two challenges, HIV and mental health, and here you see them separately, but they are in fact not separate. They are close together. Next slide. They are really what is called interdigitated. So while there is an epidemic of HIV, there's also an epidemic of mental health challenges. And we need to look and work on mental health well-being among our clients, among our friends, in order to improve the HIV program. That is our basic standpoint. Next slide, please. So in the past couple of months, we have conducted 4 focus group discussions, 2 in Ekurhuleni and 2 in Tshwane. And we had topics that went about mental health, HIV prevention, the treatment gaps, both in Johannesburg and Pretoria. And then we did an analysis of what our findings were. And we came up with a framework for an intervention. And I'm going to take you through this framework. It's a little bit complicated. Next slide, please. And the font is very small, but bear with me. I talk you through it. In the left-hand side, you see the components of what we think is important that has to go in the intervention. We'll base it on the Friendship Bench. That is a program from Zimbabwe. When the Friendship Bench refers to when people start talking to each other on a bench, but you can also talk to each other on a WhatsApp or talking to each other on Facebook, you create connection. And when you train lay counselors to provide that connection, you start offering problem-solving therapy. The core elements of that intervention are peer-led. So they are led by the core workers, the trained peer leaders. Status neutral refers to that it doesn't matter whether somebody is HIV positive, HIV negative. And it is combined both individual and group sessions. And there is an element of mHealth, mobile health. These elements go into the green area where we will work on personal behaviors and psychological skills and offer interpersonal support and involve communities to strengthen capacities. And on the right-hand side, we strengthen positive coping, more self-care, and therefore ensure PrEP uptake and ART adherence so that viral suppression improves. So that is the framework. That's the theory behind what we are offering. And the only thing that you have to remember from this slide that there is a theory behind it. Now we go to the next slide. Next slide. So in these focus group discussions, the consensus was that the participants, they supported the adaptation of the Friendship Bench. They clearly said, we don't want to sit on a bench, but we like to be connected to each other. And it was felt that when we have the Friendship Bench, we could break up silos and offer an integrated program. And yeah, that's very good when you want to ask questions in the meantime. So we are encouraged. The last bullet of my slide is this. Yeah, the improve service engagement, including online and in-person formats. Let's go to the next slide. So we agreed that we would adopt the Friendship Bench. Here is the bench in Zimbabwe, but in South Africa, we will use not a bench, we will use a versional platform. We will train lay mental health coaches, and we offer the mental health coaching online or face-to-face in 4 individual and in 4 group sessions. The 4 group sessions will always be face-to-face. And we have now, this month, is starting a pilot study of 20 clients, and we like to learn from the pilot study. So the pilot study is only for 3 months, and then after 3 months, we will interview the clients, we will interview the coaches, we will learn and listen to people, and then we hope to improve what we are offering. Last one, or next slide. Yeah, this is the team. It's a team led by Jackie Pinar and my colleague Goodman Sibeko, who is in Cape Town, and my colleague Donna Parario in the United States. And Dixon Chibanda is the genius. He is the psychiatrist who came up with the friendship bench idea. Daniela is a statistician and an epidemiologist, and he has a picture of me. So I'm open to questions now. Thank you so much.
Thank you so much, Prof. And I don't know, Happy, if you can really help us there with questions. I haven't gotten any on my side because I only have the screen to Professor's presentation. But Prof, let's maybe perhaps take a look at, or rather look at some of the points that you spoke to, especially about key populations really needing mental health services. As a response, then you come up with the friendship bench. Is the friendship bench the only out there, especially when you look at Pop In taking on the project, or personally taking on these kind of services? Are they the only ones? And so far, have you seen a response or a positive response when you take these services to the people?
Well, that's a very good question, and we often do a lot. That is, and I'm really admiring the popping clinics in South Africa offering so much already connection. But what we like to do in this study, try to find out how we can best connect to people.
Yeah.
What topics are really on people's mind, and is it being jobless, or is it being rejected, or how then can you find solutions for that, these major challenges? And there are tons of self-help, and there are tons of programs that offer connections. But what we like to find out with the ORM teams is, what is the best way of doing that? And then perhaps modifying the online learning. So the existing online learning can perhaps be improved. And that's what researchers always want to do. They want to take something what is either non-existing on something that is existing, then see how it can be improved, and then provide a better version of it, and then try to get funding for it to roll out a better version. I hope I have answered your question.
Yes, you have. Yes, you have. Let's look at some of these challenges, Prof, that perhaps maybe key populations would then be experiencing. You saying then what would be the topics that would be delved into in a more deeper perspective? Maybe and I think it. Don't you think that it might be only limiting if you are only offering it remotely, or rather digitally? And let's look at remote areas, because also I think they are more challenged as we are in cities. And I think we have the advantage of technology to go online to speak to a friend or to speak to a counselor that is put to help us with our mental health issues. But what about remote areas then? Areas where key populations who reside there don't necessarily have access to internet or have access to cell phones. How do you go about responding to that as a challenge?
You are asking the toughest questions, but these are very good questions. If you don't ask them, you're basically not with your feet on the ground, and you're dreaming you remain in an ivory tower. And I think you're absolutely right. The biggest challenge is to reach out to the areas where people are most in need of information. And I'm admiring ORM's outreach, mobilizations, go mobilize, go into the hotspots, go to networks, go to clients, friends of friends, offer self-testing, get people to take a self-test. When people test negative or positive, doesn't matter, but then try to connect to them to the popping clinic. Now you cannot start hundreds of popping clinics in South Africa, but that principle can be promoted, and the principle that you reach out to peers and start normalizing. Have you taken an HIV test? Yes, of course. No, I haven't. Have you taken an HIV test recently? Do you know about PrEP? Do you know about PrEP taking? And so you try to interest people about the basics, but then often, if you don't offer something extra, then even if people walk away with a bottle of pills and it makes a noise, they say, "Oh no, they're not going to take these pills. They're not going to take these pills because their mind is somewhere else." And that extra connection is what we try to work out in this friendship bench. And that some of it can perhaps be done through WhatsApp, which is a very cheap way of communicating. People need to feel that they belong to a community, that it is okay to say, look, I find it difficult to take my PrEP. I'm not always successful in taking my PrEP.
Yeah.
It's
Yeah.
really not. I forget. I stay over with friends. What do I do if I have forgotten a couple of days? Can I restart? So you need that communication. And back to the theory, if you could say then, well, it's not only talking about PrEP and ART. There are actually underlying traumas and underlying rejections that if we can go deeper with people, they may actually feel better connected. And when you're better connected, you may also do a better job in taking your pills. So we hope that we can make a start, and through training, lay counselors, lay coaches, potentially offer something that can be scaled. That is the hope.
Yeah. Most definitely. I agree with you there, because then it means that, Prof, there needs to be a deeper dive into these issues, because like you said, it's not only about taking the pill, but it goes beyond that. So then education needs to be given, or rather training needs to be given, to be able to equip the people that or rather clients or peers who are interested in the project, and also to really give them the service at the end of the day. I also want to touch on the objective, from especially when we borrow from Zimbabwe, because that's where it started. You look at the kind of successes that Zimbabwe has had with the friendship bench. Maybe take us through those highlights. What have they achieved? What were they able to achieve in the space of the project, or in the space of the study when it was incepted until now?
That's an excellent question. Thank you for that. That is years of work, often outside a hospital, where people either learned their status or they had lost somebody. And the way that Dixon Chibanda approached this was he trained grandmothers, people who are often around the clinic, who accompany a patient, and he helped the grandmother to say, come, just listen to a person. Listen what's on a person's mind. What is bothering you? What is actually making you down? How can you ask questions that are not non-judgmental? And that did happen on the bench, and that provided connectivity. And it was then studied that these people who had been connected and they felt heard, they actually started to be happier. And when you become happier and you become a sort of more whole person, you were able to solve a application letter that you hadn't written for many years and then actually found a job, or you were able to confront a family member and say, look, it's not fair how you treat me. And so it is building that resilience in people through connection. That clearly was successful in Zimbabwe. It hasn't been tested among MSM populations. When we started discussing it in Johannesburg and in Tshwane, the people also, it's new. We have to learn from it. Are people comfortable to share their inner thoughts? I mean, is the confidentiality ensured? Is the coach? Is it really helpful? So while we have these great ideas, we should also be a bit mindful that in 3 months we like to learn from you, from the teams. What do people feel? And it would be totally fine to say, no, this is not the way we want to go. Then we have to come up with something new. So we're really having an open mind, and we're not prescriptive in this is the best way of doing things. This is how we like to try, and then also measure if people do it better, take their medication better, feel happier, are satisfied.
And it's quite interesting because then, Prof. So mental health is not, or it shouldn't be isolated from HIV, from PrEP, from because also people who are taking these medication or especially ARVs are dealing with a certain stigma. Actually, even PrEP. So when you have an intervention like the Friendship Bench or such mental health service, then you are also responding to that. But I wanted to talk about then having the physical bench. That personally, are we going to be able to see us having a physical bench like in Zimbabwe, how it started, when somebody just comes and said, obviously they are more qualified or perhaps maybe trained in the field of mental health, and deal with somebody that is going through mental health challenges? Or are we just going to see it only being online or being digital or being on outreach when the team is taking the service to the people?
Yeah, I think the friendship bench, the real bench, I think about it as a metaphor. I mean, that's something that worked outside hospitals, but in Johannesburg and in Pretoria, we are going to use the connection, whether it is WhatsApp, whether it is face-to-face, whether it is being in a small group. We got to train people's ability to listen. And it's basically when you become a better listener, you hope to make an impact on a person's life. That is the skills we like to train in counselors. And you can listen by only sometimes giving a small nudge, like go on, or how was that for you when that happened, or tell me more about it. And then let a person be confident that he or she can say what is really on a person's mind. And that is the skills we like to train. And you don't need a bench for that. That can happen.
No.
That can happen.
Yeah. Let's look at treatment. Two last questions, and we'll let you go. Let's look at treatment because I think then when somebody's mental health, situations are dealt with, then they respond better to treatment. And let's look at if then people are not dealt with, when their mental health is not dealt with, do we see a lot of resistance when it comes to them taking treatment because they are dealing with a lot? So you are telling me that I'm HIV positive, or you're telling me that I'm dealing with this kind of illness. On top of that, you want me to take my treatment, but I'm dealing with so much mental health. I'm dealing with depression and anxiety. Is it better when they are given mental health services and then come to their health holistically?
The way these programs work everywhere in the world, it is so important to suppress viral load when you test positive, that the earlier you can start, the better. And sometimes people first have to start with TB treatment or take also prophylactic TB treatment. And the burden of taking treatment is already on their minds. Shortly after starting treatment or shortly after starting PrEP, one can be supported by further mental health coaching, and it is better to think about it like well-being coaching. There will be people who have a more severe depression, and you then need to refer those clients to either medication therapy or to more professional help. But we are aiming to make an impact on actually many of us, including you, me, we all have issues on our mind that if we are confident that we can talk about it in a more casual way, our days become happier. That is what we try to promote. That's what we try to mean with mental health well-being.
Yeah, I got you. And I think, I think Jackie at one of the webinars spoke about mental health being the next sort of like pandemic that we have to deal with it. And it's quite interesting that studies like these are in place. Prof, I really appreciate your time. In closing, perhaps maybe remind us when is the study starting, and perhaps maybe tell us what would then be achieved with the study as we close.
Thank you so much. And I just received an email that the study has started today in Tshwane. So the 2 first clients were enrolled, and that means they have participated in a survey. And after a couple of weeks, we will select from the respondents in that survey we select only 10 clients from Tswane and 10 clients from Ikuruleni to go into this Friendship Bench online coaching. And that's so that the real intervention will start by half August, will run for 8 weeks up to half October. And at the end of October, we will get our findings together. We share our findings back with the communities. And by that time, we also hope to have the formal big grant from the NIH to study this during a period of 3 years. This is only meant to be a pilot study to oil the wheels, to make everybody understand what we're aiming towards to. And when we get the big fund, January, maybe February, we start and have a big kickoff meeting, and we will be talking seriously about mental health interventions. So we're here for the long run. I hope you see me quite regularly for the next, maybe 7 years. You never know, but I'm incredibly proud on what Orem is doing. I'm really happy that I have joined Orem and that I have such a good feel and response from the team. Thank you so much.
Most definitely, Prof. Thank you so much. Definitely, we are looking forward to having you for the next 7 years. And the wells are oiled, so we definitely see the work. Really appreciate your time. But you've just joined us, you've missed it. Prof. Edward was giving us the round on what mental health looks like in South Africa and what is, the intentions of the Friendship Bench and how far it's willing to go. So make sure that you check out this episode of the webinar. And until we see you again, have yourselves a beautiful afternoon. Happy streaming. Thank you. Thank you, Happy, for the behind the scenes. Really appreciate it. All righty. Bye.
Bye.
All right.